Hello everyone. Today we'll continue with the presentation. This is part two of the New Jersey Eldercare Planning. We'll start with the insurance component of the presentation. The second part of the New Jersey Eldercare Plan presentation will focus on insurance. So we're going to talk about Medicare as it relates to senior. And when we talk about senior or older adults, we're talking about people ages 55 and over for this presentation. So original Medicare, for those who do not know what that is, when you often hear the term, it's basically Medicare Part A and Part B, and it covers 80% of the cost for doctor's visit and other services depending on the plan that you have. So I cannot tell you what your plan may cover. It depends on the plan that you have. And Part A, you're automatically enrolled by your age. And if you are younger, you can receive Medicare if you have a disability and you apply through the Social Security Department. And Part B, you will. So most people call to apply, and you will call Social Security or the county, the Board of Social Services in your county. And Part D, you could call to apply and you could use any provider, meaning that you could use an HMO provider, whether it be NJ Horizon or Aetna, United Healthcare, and I do have at the end of the slides a lot of different Medigap and HMO providers that you could call and inquire about the services that they provide that fits your needs. And then you have the HMO Advantage Plan, which is these plans you have to go to provider in network, so it's like a referral provider. And then you have the supplemental, and with the supplemental for seniors who have retired and they lived overseas, they do have an option for international plan, and also the Medicare Advantage plan, which we'll cover later on. It covers 20% of the medical expensive, and the Medicare Advantage plan can be used interchangeably with Medigap. So it was once called Medigap, but now it's called Medicare Advantage plan. And if you are in an HMO, meaning that you have United Healthcare, you can enroll in the Medicare Advantage plan. Let's let's talk about coverage. So Part A, which most people are familiar with, is hospital insurance, meaning that it helps cover inpatient care. Say, for example, mom has a wound and she needs wound care, or she broke a hip and she's hospitalized. It will cover the cost for the hospitalization and skilled nursing services. So in Part 1, I mentioned the skilled nursing services, which can be termed as home care services that Medicare covers, and these are services such as someone may come in the home within 24 to 48 hours after the person has been discharged from the hospital, where the nurse will do an assessment to assess the need. They may at some point may be provided with a home health aide nurse. Not everyone is provided with one. That is why they do the assessment. And they have the other component where they'll have physical therapy at home, or they could go into the community to do physical therapy. So this is a component where you will get a home health aid, so you will get home care services as it relates to Medicare. But you need to have a skilled services, and skilled services could be, as I mentioned before, wound care, it could be IV services, and any other services that are skillable. And Part B covers medical insurance, which are services such as like an outpatient. So if dad is going to primary care for outpatient services to a geriatric senior care services, they'll provide services like that for that, and they'll provide services for home care if they qualify for it, but it has to be a skill present, and they'll cover services for any physical therapy, speech therapy, as long as the doctor deemed that it's necessary, and they could receive a referral for that as well at some point and in some cases. Medicare also covers DME equipment such as which is durable medical equipment such as wheelchair, hospital beds, but in most cases they have to get a referral. When I did geriatric home care, the doctor would write a script, meaning a prescription for that. You could either take it to a medical supply store and receive it, or the provider could order it for you through any vendors, such as Ocean Health Services, or I know with Hackensack they do have their own vendor that will order it for you and it will be shipped to your home, or you could come and pick it up before, or you could take it with you before you're discharged. And we're going to talk about Part D Medicare, which is a drug coverage, and it basically helps cover prescription costs. And this is what you have to pay extra. This is not automatically applied to given to you once you're qualified for Medicaid. So this is like extra. So, and also one thing to ask if you do not have drug coverage and you have a primary care geriatric provider, just ask for the pharmaceutical, a lot of these pharmaceutical companies, they have prescription assistant program, and I did work with a lot of these pharmacists, pharmaceutical companies that do the medication for shingles, the shingles vaccine. We do a lot of other medications, Gardasil. We do a lot of other vaccines. So if you are able to get a script and the provider participate with these company, you can get those free of cost depending if you do not have these prescription drug coverage. So we're going to talk about the Medicaid services, the services that are covered under Medicaid. So if you do have Medicaid, and remember, Medicaid is for those who is income driven. If you have a disability, if you're low income, you will receive Medicaid. And I did mention in part one how you can transfer your income into the QIT account in order to be qualified for Medicaid. And there's a lot of stipulations, so it's best to speak with someone from your county. So this is basically informational to let you know what services are available, not to determine that you are qualified for these services, just to let you know for informational purposes only. So Medicaid services, you can get mental health services. They do cover a lot of towns around Passaic and Bergen County. They do have Medicaid services providing mental health, such as CDH, community clinics, and a lot of other clinics. And they provide DME equipment, such as wheelchair, walker. They provide home care services, which I think is a big thing, and also transportation services. And for those who need transportation services like logistic care, if you have Medicare, I know logistic care, they're now called motive care, but a lot of people know them as logistic care. If you have Medicaid, you can get free transportation to and from your doctor's appointment. And I know whether you have Medicaid or not, as you could get it as long as you're disabled or you're a senior, you could, and you're not able to take the public transportation, you could use logistic care. So there are a number of ways to sign up for logistic care. So the easiest way that I know of, I used to help my patients with this at the center. I would have complete the form, have the doctor certify the form, mail it to logistic care and follow up, and they will call the adults to conduct an interview to see if they're eligible, they meet the eligible requirements for the service, and then they'll proceed from there to see if they're qualified. And if they're qualified, they'll have this number where they'll use to in the future to schedule appointments to and from their doctor's appointment. And with Access Link, it's a New Jersey transit transportation services. You don't have to use it to go to the doctor's appointment. You could use it to go to like the diner. If you're meeting like the seniors want to go to the senior center, they could do that as well. And it's a door-to-door transportation, meaning that for the most part that I'm aware of, they do not like lift you and take you up into your home. They drop you off, so the adults have to be able to come outside they'll help you get in if you have a need for a wheelchair to get into the van. However, there is a fee. I know it ranges depending on your location. So sometimes I've seen people pay $1.50, $2. And also with Access Link, if you have a family member that is in the nursing home, and say for example you want to take them out to eat, you could have you could have Access Link take them from the nursing home, and you could accompany them too as well. So that's a great option. And there are other transportation options that does not involve Medicaid, since we're on the topic of transportation, such as taxi for senior, Ubers for senior, and they do like door-to-door transportation with a cost. And moving going back to the services that Medicaid provide: physical therapy, occupational therapy, inpatient psychiatric services, and so forth. And just to bear in mind, a lot of places do not accept Medicare for inpatient psychiatric services similar to nursing home. Like when you go to a nursing home, Medicaid is not going to cover for a nursing home. So you say, for example, mom broke her hip and she needs to be transferred to the nursing home and she no longer can return home, she would have to apply for Medicaid, and her income, they will do a 5-year look back, financial look back, meaning that they will look in her finance for the past 5 years. Say for example, hypothetically, mom gave away $10,000 to her granddaughter for college. That would be used as a penalty, meaning that, you know, you were able to afford that. So whatever the penalty agreement with the county is, mom would have to go by that stipulation. And say, for example, mom had $10,000 transferred to an account. They want to know where that go, because the purpose of that is to see if this person is indeed eligible for the government to pay their money to have her cared for in the facility. And if mom is not coming back home and mom didn't have Medicaid, and they have to apply for Medicaid. So if the daughter decides to transfer the home, because I've seen this done a lot of times, mom is going to the nursing home. The family member wants mom to be able to qualify for Medicaid, so they'll sell the house or transfer the home in their name. It doesn't work like that, because once it's within the 5 years, they're gonna look back and you will need to either transfer it back into mom's name, or it's gonna be a penalty. When we talk about the Medicare supplemental insurance, we're talking about the Medigap, formerly known as Medigap, which is extra insurance. This is not something that you have to get, but it's good if you have that. So it's like extra insurance you have, so that it could supplement, as the term suggests, supplement care and services that traditional Medicaid, original Medicare does not provide, such as Part A and Part B, those are the original Medicare. So you can have a supplemental insurance, and I did have some forms of different supplemental agency you could buy this extra insurance from in New Jersey. So they provide like standardized care, such as, and it goes by letters, such as Part G, Part K. I've seen a few people with Part G. It covers that type of supplemental insurance. They, depending on the plan you have, they can cover nursing home care, such as skilled nursing care, which original Medicare does not cover. Only Medicaid covers nursing home care. So if you want, you can go ahead and purchase a supplemental insurance plan, and depending on the plan, the plan can include coverage for nursing home care. So by now, the biggest difference between Medicare and Medicaid is, Medicare is a federal health insurance for anyone 65 years and older. And as I mentioned before, you can receive Medicare if you're under 65 in some cases of disability. So Medicaid is state and federally funded, but Medicare is a federal funded program. So, as I mentioned, Medicaid offers a lot of benefits such as nursing home care, personal care services, which you could have a family member take care of you through the PPP services and get paid, or through personal care services where you could have a home health aid agency send a professional home care person to help you with home care services such as bathing, activities of daily living, um, instrumental activities of daily living, and other type of services. A lot of people may know about the Breathing Health Insurance. So as of October 2002, Braven Health rolled out, which before Braven Health is like an affiliate of Horizon Blue Cross of New Jersey, and they partner with Hackensack and Robert Wood Johnson, Barnabas Health, um, and they offer the Medicare Advantage plan. You get it through them. So if you have a senior, it's if you don't know where to look, this is like a great step to look, and members enroll in Braven Health have network access to Horizon Managed Care through Hackensack and other local service areas. So it doesn't have to be a Hackensack hospital affiliate hospital, but it can be through other county, any one of the 21 counties in New Jersey since October 2021. Because I know before it was Raven Health was only used through the affiliate Hackensack and Barnabas Health, but now you could use it through all 21 counties in New Jersey. So these are some additional resources with most of the counties in New Jersey where you could contact the Board of Social Services. Passaic County, Essex County, and Hudson County, those are three of the most easy accessible ones because I have called them myself and they were very helpful. Whenever you call Bergen County Social Service Department, they're helpful, but it's just a matter of getting in contact with them. You could leave a voicemail message, but they'll call you back like at some weird time and you'll not get the message. But for the most part, they're very helpful. But I encourage you to call the Board of Social Services. If you go on the website, the New Jersey website for aging and senior, you're trying to fill out the New Jersey Medicaid for senior and you're having difficulties with uploading the information because you're not familiar with the system or you're not tech savvy, you could always call the Board of Social Services to ask these questions. And you could also, they have a Dropbox for some of them who are not doing face-to-face interview, conducting face-to-face interview, you could conduct the interview over the phone to apply for the Medicaid if you don't want to do it online, but that's the fastest way to do it online. And also you would have to call them and they'll tell you how to leave the paperwork like in the Dropbox, like any time of the day, you could leave it in the secure Dropbox. So this is for informational purposes for those who want the correct number for these services in different counties. These are additional as well. So Essex, Morrison, Hudson. I don't believe I have all counties, but for the most part, I was trying to focus on the northern region mostly, central and northern region, so you'll find more information. But the information here is applicable to all New Jersey county. So it may be applicable to other state, but I just wanted to focus on New Jersey because different state has different stipulation when it comes to eligibility requirements. Again, we have Middlesex, Warren, Burlington County. So we're going to talk about behavioral health services, which is mental health services such as therapy or services from a psychiatrist or a psychologist, but mainly from a licensed clinical social worker for the purpose of this slide. So during COVID, I've seen a lot of seniors who are socially isolated, who normally would be able to go to the senior centers and interact with their friends at the diner or other family member have been closed off. And throughout that time, a lot of mental health issues have emerged. And sometimes when you have family members who only have Medicare, they don't know how to navigate the system. So I have compiled a few resources for mental health services that you could access. Some of them, I think most are in person, but I think a few are telehealth for those senior who are apprehensive when it comes to going face to face. So I have these listed here and the type of insurance that they take. So we're going to focus on Medicare and Medicaid because I think a lot of people that I made this video for, they want the Medicare, people who accept those insurances. So first and foremost, they have the Wellness Center. So that is in Hackensack. That's a part of Hackensack. It's over by the Giant Center on Route 17. They do have a wellness center program. And I believe when you call, they have a package. That's the only downside I see to that. They have like a package is this thick. You have to fill it out. But I think they could work around if you're a senior and you don't have access to complete it, scan it, and send it back to them. I think they could work it out. But they don't have social workers there or therapists. They do have a psychiatrist there for medication management and therapy with the psychiatrist and medication management to manage your medication, your psychotropic medication. So, and then they have Bergen Newbridge, Bergen Regional. They do have an access center for mental health services, and this is for people who do not have insurance or have Medicare insurance or Medicaid. So if you have Medicaid, they do accept that, and that's through the outpatient department, and the number is there. And then if you have Medicare, so the Center for Purposeful Aging in Hackensack, I know Miss Miller, have, she does accept Medicare, so that's a good option. But also call for therapy service for seniors. She only accept referrals or for seniors. Continuing with behavioral health services, you have the Hudson River Care and Counseling. They do accept Medicare and supplemental insurance as well. So you just have to call and schedule an appointment and do an intake. And I know this is a popular one, Tenafly Psychiatric Services. They offer services for seniors. And all these resources I'm talking about, I don't want to keep mentioning it, is for seniors. So they do have a psychiatrist there that accept Medicare and other HMO insurance such as Aetna, United Healthcare, and Horizon Health Blue Cross. I hope you can take a screenshot of this chart. I'm gonna try to add the other pages. It was about 7 pages of the Medigap chart, which is a supplemental insurance. Remember, the Medigap is supplemental insurance. So they do have a lot of, I had it in my email. I got it from the county. So they do have a lot of insurances, and they tell you what it covers. They tell you who to call, and they have the number of the places to call. They don't show you the cost, but they show you like percentage wise, so that's a good option for you to see. And this is a continuation of the supplemental insurance plan. The Medigap, it tells you the benefits, the plan, and it also shows you, like, if you zoom up on this, it's showing you like and this is for 2013. So open enrollment is going on now. So now is November, so it's showing you 2013. So we wouldn't have 2022. So this is very updated. So they'll show you like Plan G, Plan A, B, C, L, M, and they'll show you what it covers. So it's a very comprehensive list to give you as a guide, so that when you speak to any of the insurance company case managers, you'll be able to express what you need and see what you are able to afford and what services that you need to be covered. In this slide, we have we have a few links. So we have the Bergen County Board of Social Service, where you could find a lot of information. We have the NJ Helps, which you could find the Medicaid application. However, the New Jersey Human Service website is the best to do so, and I'll also include a slide on how to access that website. And also, this is the Bergen County Housing Authority, where you could see a list of senior housing that are open, where they have the wait list open. And this is the link to apply for the Bergen County Housing. So you could click on either one of them. Thank you for tuning in to this presentation. If you do have any questions, please send me an email to the Center for Wellness Solutions at gmail.com, or you could call the number at the bottom and leave a voicemail message. Thank you again for listening to the presentation, and I hope this presentation was helpful for you in some way.